It's really important to recognise that you will find it confronting and that people will stare at you, you know, and that can be very frustrating and you will get sick of it, but try and remember what you would have been like prior to the surgery. And one of the strategies we often use is getting people to say, have a good look, get used to my face, and then we can have a normal conversation. One of the other things that's important to remember is your family and the people that care for you will get used to it before you do, because they're seeing it all the time, whereas you're not. So it's important to remember that although you feel very conscious of it, they get used to it a lot quicker. They're seeing it all the time.
You're thinking to yourself, you don't know what to expect, what you're going to look like when they take the dressings and that off, and how you were going to react yourself to seeing yourself like that.
I think it was very important that I was in there with you.
Yeah.
There was a bit of a point there where one of the nurses had said that it probably wouldn't be a good idea if I was, but having been through it again, I wouldn't have missed it for the world, because Ronald said to me, Annette, I want you to come and stand and have a look. And as much as I was shocked, it was a good thing to be there with you, wasn't it?
Yeah. Because there was when we were in there, in that 48 hours, there was a psychologist come in and seen me and spoke to me and everything, and he was the one that suggested that it'd be good for Annette to be in there as well with all the nursing staff and everything for when they took it off, instead of just waiting till I got home and then doing it and no one around. Because then I was worried how Annette was going to react. And I think Annette was worried about how I was going to react. You know, it's just...
And it was a shock. It was a real shock, but...
we had to deal with it.
The time was right to go and have a look at what had happened. But I remember Rani, one of the nurses, came in with me, and I looked in the mirror, and I can't really remember what I said. I think I just said, oh, it's not that bad or something. Is that what I said, Rani?
Quite the opposite, actually.
Did I?
Yeah.
What did I say? I can't remember.
You were horrified.
I was so horrified.
Yeah.
I can remember saying, you've been making me walk around and get a coffee looking like this.
Yeah,
and,
no, she was very, very kind of terrified of what she saw. But I guess you have all these, you know, preempt ideas of what you think it's going to look like, but I guess when it's on you, you know, it's a little bit more shocking. So
I didn't even see my stitches or anything until about, I think it was about 3 or 4 days afterwards. I was even like getting up and going to the ladies' room, but there's a mirror in there, but I never noticed it for the first couple of days because I was still so drugged out, I suppose, or out of it, you know, that I couldn't, I didn't even think about it. And then I sort of happened to look one day in the mirror and I nearly had a heart attack. You know, I just had these staples and stitches everywhere, and I looked like something out of a Frankenstein movie. And especially the trachea sticking out of my neck, you know, and that really frightened me, sort of, you know, when I first saw my face, I suppose, yeah. I'm not worried about the scarring. You know, I consider it a survival scar.
One of my fears in regards to the whole operation was it was going to impact greatly on my face, as that was going to be sliced open. And the biggest fear was how much my face was going to be impacted. And on first waking up with the scarring and the stitches, it was quite horrific. But as the time goes on, everyone notes how well the scarring has done on my face. And it's quite hard to actually see the actual stitches unless you really point it out. At the time after the operation, because it's still new, looks quite horrendous, but the actual recovery of it is quite amazing. And I was quite amazed at how little damage to my face has actually been done.
One of the nurses that was there at the time said, look, Deb, you've got a lot of swelling. They were reassuring about there's a lot of swelling. There's staples all over your neck and your face and your arm. You're not going to look like this in 6 weeks' time, okay? So having that reassurance that this is as bad as it's going to get and you will recover and the swelling will go down and the stitches will be removed and, you know. So the reassurance you do get does help, but I think as a human you're going to go through it and you're going to feel how you do at that given time. You have to get there the 6 months down the track. You can't see that, but you will get there, and when you get there, it's okay.